Rising obesity levels around the globe was one of the dominating health issues in 2008, but it wasn't all bad news, as medical experts revealed a number of new techniques for dealing with serious and fatal illnesses.
Governments worldwide are struggling to tackle obesity, and many doctors in the West say it has reached epidemic proportions. The World Health Organization says obesity causes multitude of serious illnesses such as diabetes, heart and liver disease. In the United Kingdom's Institute of Food Research, scientists are experimenting with ways to trick the body into feeling full, using simple foods found on everyone's shopping list.
If you can slow down the digestion of fat in the body, the undigested fat goes further down the small intestine, and then the gut then sends a message to the brain to reduce your appetite. So you can eat a normal-sized meal, and the digestion is slowed down, and then the message goes to your brain to reduce your appetite, and you go for longer without being hungry.
Although doctors are experimenting with new ways to deal with illnesses, a common complaint of doctors is that it can be many years before patients experience the benefits of exciting breakthroughs in the laboratory. In order to tackle this problem, a new multi-million-dollar center opened this year at St. Thomas's Hospital in the United Kingdom. Doctors here are convinced that putting cutting-edge research scientists literally beside clinical doctors and their patients will dramatically reduce the amount of time it takes between finding a diagnosis and then finding a treatment. Among the first of those patients benefiting from the clinical research facility is Barbara Mitchell, who struggles with sickle cell disease. Her ultrasonographer, Ann Donald, says doctors want to know precisely about the disease.
We now know that there is a link with what happens in sickle cell and the release of nitric oxide in sickle cell, and what happens in the endothelium, which is the lining of the blood vessels, and the release of nitric oxide there. So we want to see if we can find out what that link is.
In the Southern Hemisphere, the organization Diabetes Australia has been at pains to highlight the fact that Indigenous Aboriginal community remains the worst affected of all the communities. Now a foundation has been set up by Indigenous Australian singer Jimmy Little to educate and support the Indigenous suffering and at risk from diabetes. In the UK, the diabetes spotlight was put on how schools often fail to cope with children suffering from diabetes. The charity Diabetes UK claims many children are made victims of their own disease because their schools aren't able to support them. 14-year-old Diana House is one of the more fortunate of the 20,000 children suffering from diabetes in the UK. She looks and acts like most other teenagers, but her school recognizes that she has a chronic condition.
It could affect her eyes, her heart, her kidneys, her circulation. She could end up losing limbs. So I need to know 100% that she's safe and well looked after at school.
Diana's teachers have been told what her disease entails. She's excused from class whenever she needs to check her insulin levels and has access to a treatment room where she is able to take a glucose tablet or replace the needle for her insulin pump. But Diabetes UK says too many schools are making this impossible. Diabetes UK wants the government to force all schools to have policies in place to help children like Diana House. In 2008, health experts were also concerned that many women are sacrificing their physical well-being for a designer image. Last year, shoe designers have found themselves under the doctor's microscope, and their stiletto creations have been getting the sharp words of criticism from the medical profession. But women still love their heels.
I do enjoy wearing my heels. I wouldn't leave home without them.
Consultant orthopedic surgeon Desan Singh says high heels have led to growing number of bunions, hammer toes, and in some cases, broken ankles.
There are podiatric surgeons who have performed surgery for painless bunions, or who have even amputated a fifth toe so that a patient can fit into a narrow shoe. But this is not something I would like to advise, and I think it reflects the fact that the podiatric surgeons do not have any medical qualifications.
Progress in imaging equipment and scanners has helped doctors diagnose cancer patients at the earliest possible opportunity. Doctors in the UK use positron emission tomography scanners to detect tumors and to test whether new drugs are effective. With the help of the PET scanners, doctors can now look for new methods to treat patients. Last December, we were given a glimpse at the new technologies being devised by doctors whose inventions are being prompted by the needs of their patients. At the Medical Future Innovations Awards, Professor Kevin Shakeshev unveiled his extraordinary liquid bone. It starts off as the same texture as toothpaste.
The material will harden spontaneously at body temperature. And over a period of about 15 minutes, it will convert from this toothpaste foam-like material into a very hard material, which is as hard as human bone.
The innovation could drastically reduce the need to take bone grafts, which means doctors don't have to use invasive surgery on two parts of a patient's body to heal just one area. The fluidity of the substance also can be injected into awkward areas of the body. TITV Weekly.